This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I'm Anuja Kumar and with me is Subhadra Ramachandran. The headlines. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. Indian Council of Medical Research and Bharat Biotech to develop a fully indigenous vaccine for coronavirus. Special flights carrying stranded Indians abroad continue to arrive in different parts of the country. INS Jalashwa to reach Kochi from Malé this morning with 698 Indians on board. National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. And US approves new coronavirus antigen test with fast results. The Health Ministry has decided to deploy central teams to 10 states that are witnessing high caseload and high spurt of COVID-19 cases. The teams will assist the state health departments to facilitate management of COVID-19 outbreak. The states are Gujarat, Tamil Nadu, Uttar Pradesh, Delhi, Rajasthan, Madhya Pradesh, Punjab, West Bengal, Andhra Pradesh and Telangana. Our correspondent has the details.
The central teams are comprised of a senior official from the Health Ministry, a joint secretary-level nodal officer and a public health expert. They will support the state health department in implementation of containment measures in the affected areas. These teams are besides the 20 central teams of public health experts who were earlier sent to the high caseload districts. A high-level team had recently been deputed to Mumbai to support the state efforts in COVID-19 response and management. With Divakar, Suparna Saikia, AIR News, Delhi.
Indian Council of Medical Research ICMR and a Hyderabad-based leading vaccine manufacturing company, Bharat Biotech International Limited, have partnered to develop a fully indigenous vaccine for COVID-19. The vaccine will be developed using the virus strain which has been isolated at ICMR's National Institute of Virology NIV Pune. The details of the virus strain has been successfully transferred from NIV Pune to Bharat Biotech. Work on developing the vaccine has been initiated by the two partner entities. NIV will provide continuous support to Bharat Biotech for vaccine development. ICMR and Bharat Biotech will seek fast-track approval to expedite vaccine development, subsequent animal studies and clinical evaluation of the vaccine. In the world's largest evacuation plan, Vande Bharat mission, the government in the second week of evacuation, commencing from 16th of this month, will repatriate approximately 25,000 people. Around 106 flights, including from Canada, Russia, Europe, Australia, US and Gulf countries, will bring back stranded Indians from these countries. In the first week of the Vande Bharat mission, which started on 7th of this month, around 15,000 people from 12 countries are being evacuated.
A flight from Doha landed at Kochi in Kerala early this morning as part of Vande Bharat mission. Our correspondent has filed this report.
Flight carrying 178 passengers reached Kochi International Airport early morning today at 1:40 a.m. One flight each from Muscat and Kuwait carrying expatriates also arrived last night in Kochi. Passengers of all flights after detailed medical screening were sent to state quarantine centers except pregnant women, small kids and very aged people who were sent for home quarantine. Meanwhile, the state government's call for complete lockdown on all Sundays comes into effect from today. Only essential services are allowed today as part of effectively containing COVID-19 in the state. Mayusha for AIR News from Thiruvananthapuram.
An Air India flight carrying 163 Indian nationals stranded in Kuwait landed at Shamshabad International Airport in Hyderabad last night. This is the first evacuation flight to Hyderabad under the Vande Bharat mission. All of them have been sent to quarantine for 14 days after due health screening. More from our correspondent.
The first flight under Vande Bharat mission has arrived at the international airport in Hyderabad little past 10 p.m. last evening, bringing home 163 Indians stranded in Kuwait due to lockdown during the current COVID-19 pandemic. As per the airport authorities, social distancing norms have been maintained and the passengers have been brought in small groups for medical screening on arrival. Prior to that, the international arrivals and the entire stretch right from Aero Bridge to the arrivals ramp have been sanitized and fumigated. Each passenger has been screened by the thermal cameras positioned at the Aero Bridge exit by airport health officials prior to immigration formalities. 7 more flights will arrive at the airport in Hyderabad from 5 other countries for next 1 week. Lakshmi, AIR News, Hyderabad.
A Vande Bharat mission flight from Kuala Lumpur arrived at Trichy International Airport last night with 177 passengers. This is the third aircraft to land in the state with the evacuees from abroad. The passengers have been quarantined after taking samples to test for COVID-19 infection. Another aircraft is scheduled to reach Chennai from Kuwait with about 200 passengers tonight. The number of corona-positive cases in Tamil Nadu has surged to 6,535 with the confirmation of 526 people with the disease yesterday. A record 219 people were discharged yesterday, while 4 others died, taking the toll to 44. The active case load in the state is 4,664. More from our correspondent.
756 COVID-19 patients who do not show any symptoms have been shifted out from the Stanley, Hill Park, GH and the super multi-specialty hospitals in Chennai. They have been moved to the COVID-19 care centers established at the city's prominent colleges and Chennai Trade Center. 176 others with separate rooms for their own in their houses have been sent back for home isolation. If they develop any symptom, they will be provided personal medical attention. The move comes in the wake of reports that more than 80% of the patients are asymptomatic. Meanwhile, the Chennai wholesale market for vegetables and fruits that was shifted to Tirumalizai in the city suburb is set to function from today. Jai Singh, AIR News, Chennai.
A special flight carrying Indian nationals from London arrived at Mumbai's Chhatrapati Shivaji Maharaj International Airport in the wee hours today under the Vande Bharat mission. A total of 329 Indians were brought back in this special flight from London. The repatriation operations will see the Mumbai International Airport catering to 10 flights and 6 transit flights in the course of 7 days. The city will welcome stranded Indian nationals from countries such as UK, US, Singapore, Malaysia, Bangladesh and Philippines. More from our correspondent.
The Chhatrapati Shivaji Maharaj International Airport in Mumbai will cater to approximately 2,350 Indian nationals in the span of 7 days coming from different parts of the world. Besides, the arrival of Indian nationals from London, stranded passengers from Singapore and Manila will also be brought back through the special flights later in the day. 2 dedicated aero bridges have been identified for repatriation flights at the airport. In compliance with the guidelines, passengers have been asked to maintain a physical distance of a minimum of 2 meters through distinctive markings laid out at the airport and are required to wear face masks and hand gloves during the entire course of their journey. Meanwhile, a special Shramik train carrying over 1,100 migrant labourers left Pune late last night. Kunal Shinde, AIR News, Mumbai.
Indians stranded abroad have started arriving in Uttar Pradesh under Vande Bharat mission. A flight carrying around 180 people reached Chaudhry Charan Singh Airport, Lucknow last evening. These passengers were received by the officials of Lucknow district. After thorough medical screening, the travellers were sent to 14-day quarantine in Lucknow. The passengers were given option of either to be quarantined in Lucknow for 14 days in a government centre or in a chargeable hotels at a reasonable amount. The state government is also bringing back its stranded labourers from other states and trying to provide them jobs near their native places. More from our correspondent.
The government has instructed to make an elaborate plan to generate jobs for 20 lakh migrant laborers and workers in the state. As of now, more than 1,20,000 migrant workers and laborers have been brought back by more than 114 special trains from other states. Additional Chief Secretary Home Avnish Awasthi said that government has planned to run 40 special trains per day for extended migrant workers for next 2 days. There are 1,800 active cases of COVID-19 in 62 districts and 1,399 patients have been cured and discharged so far in the state. The recovery rate of patients in the state is 43%, which is 13% higher than the national tally. MS Yadav, AIR News, Lucknow.
Qatar and Kuwait are working to send their second flight back to India today with more than 300 distressed people. Qatar sent 178 people on their first flight to Kochi yesterday, while Kuwait sent 2 flights, one to Kochi and other to Hyderabad, with more than 320 people on board. Today there will be a flight from Doha to Thiruvananthapuram and another flight from Kuwait to Chennai.
From the Gulf countries of UAE, Kuwait, Qatar and Oman, nearly 850 distressed Indian citizens on Saturday were flown back home by special flight. More than 300 people are likely to be flying out today. From Kuwait, more than 170 people are expected to be going back. From Qatar, an equal number of people will be going back to Thiruvananthapuram. In an interaction with media on Saturday, P. Kumaran, the Indian ambassador to Qatar, said that they are working on more flights to different places in India in the second phase of Vande Bharat mission. According to the ambassador, more than 40,000 people have registered on the e-portal in Qatar for going back to India. He also said that Indian prisoners who have been granted amnesty by the Qatar government can be considered for being sent back on these special flights to India. Kanchan Prasad, AIR News, Dubai.
As part of Samudra Setu program under Vande Bharat mission, second ship of Indian Navy scheduled to leave from Maldives for Kochi, while the first ship will reach Kochi today. INS Magar will leave for Kochi today carrying around 200 Indian nationals from Maldives' capital of Malé, and preparations regarding it has already begun. Indian High Commission in Malé has made arrangements for passengers to reach Malé Airport, where immigration and other formalities are to be carried out. The first ship, INS Jalshwa, had left from Malé on Friday evening, carrying 698 passengers, including 19 pregnant women and 14 children. The evacuation is part of Indian government's program to evacuate Indians stranded abroad.
The second Indian Navy ship is scheduled to leave for Kochi later today, and Indian High Commission in Malé had released a list of 211 probable passengers yesterday. The High Commission, with help of local authorities, have made elaborate arrangements for local transport and bringing them from islands spread over the country. The two Navy ships are expected to bring back similar number of people back to Tuticorin in Tamil Nadu next week. Meanwhile, the ship INS Jalaswa, which had left Malé on Friday night, will touch Kochi base today. All the 698 passengers are to be quarantined for 14 days before they can go back to their respective places. Santosh Kumar for AIR News from Colombo.
Indian Railways has operated 283 Shramik special trains across the country till yesterday. Railways had decided to operate Shramik special trains after Home Ministry's order regarding movement of migrant workers, pilgrims, tourists, students and other persons stranded at different places by special trains. These 283 trains were terminated in various states including Andhra Pradesh, Bihar, Uttar Pradesh, Himachal Pradesh, Jharkhand, Madhya Pradesh and West Bengal. The trains have ferried migrants to cities like Prayagraj, Chhapra, Balia, Gaya, Purnia, Varanasi, Ahmed and Lucknow. A maximum of around 1,200 passengers can travel, observing social distancing in these trains. On the request of Himachal Pradesh government, Railways will run a special train from Goa to Una to facilitate movement of people of Himachal Pradesh stranded in Goa. This was stated by the Chief Minister Jairam Thakur while interacting through video conferencing from Shimla with the people of the state stranded in various parts of Goa due to the countrywide lockdown. The Chief Minister said he has requested Railway Minister Piyush Goyal to run a special train from Goa to Una in Himachal Pradesh. He said the Railway Minister has agreed that a special train will start from Goa on 13th or 14th of May to carry the Himachalis back home. Mr. Thakur said 1,204 people from Himachal Pradesh are stranded in Goa.
Haryana Home Minister Anil Vij has appealed to the migrant labourers not to go to their home state by foot or on bicycle. Haryana Home Minister said the government has made arrangements for sending 8 lakh migrant labourers to their home state who have registered themselves on the portal. He said number of migrant labourers who have reached Ambala from Punjab by foot and on cycles will not be allowed to move by the Punjab government. He said that some migrant labourers who have expressed a desire to come back to Haryana will be called back after getting a no objection certificate from their state. Civil Aviation Minister Hardeep Singh Puri has said that preparations to restart domestic flight operations are in place, and as soon as a decision is taken in this regard, the industry will be able to take off immediately. Talking to a TV channel, the minister said the ministry also foresees changes in the way people would travel with strict adherence to the social distancing norms. He said there will be changes in SOPs related to flight operation. He informed that once the airports would reopen, long queues would not be allowed. People shall be asked to reach the airports well before the normal time. He added baggage entitlement might be reduced and meal services may be stopped. He said all these things will be finalized after consultation with the airlines. The minister added that the calibrated reopening can happen after the lockdown. He said during lockdown, hundreds of flights of Lifeline Udan have carried essential supplies to various parts of the country so far. This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. Indian Council of Medical Research and Bharat Biotech to develop a fully indigenous vaccine for coronavirus. Special flights carrying stranded Indians abroad continue to arrive in different parts of the country. INS Jal Shwa to reach Kochi from Malé this morning with 698 Indians on board. National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. And US approves new coronavirus antigen test with fast results.
National Disaster Management Authority NDMA has issued guidelines for restarting manufacturing industries after the lockdown. In its guidelines, NDMA said the state governments will ensure that off-site disaster management plan of the respective major accidental hazard units are up to date and preparedness to implement them is high. It has also advised that all the responsible officers of the district will ensure that the industrial on-site disaster management plans are also in place. They will ensure standard operating procedures for the safe restarting of the industries during and after COVID-19 lockdown. In the guidelines, the NDMA has advised the manufacturing industries to consider the first week as trial or test run period while restarting the unit. In view of lockdown, the evaluation for Class 10th and 12th board examinations will be done at home by the teachers. Over 1.5 crore answer sheets of already conducted exams will be delivered at homes of teachers for evaluation. This was announced by Human Resource Development Minister Ramesh Pokhriyal Nishank yesterday. He said 3,000 evaluation centers have been identified by the CBSE from where answer sheets will be sent to teachers' homes. The minister said this process will start from today and it is likely to be completed within 50 days. He expressed confidence that the results of Class 10th and 12th board examinations will be declared soon. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Amarchand Bajaj, Senior Consultant in Sitaram Bhartiya Institute of Science and Research, New Delhi, highlighted the importance of hygiene and how to maintain it to contain the virus.
जब तक हमारे पास इनकी ट्रीटमेंट वैक्सीन या मेडिसिन के रूप में ना निकले तब तक हमें जो प्रिकॉशनरी मेजर्स है वो फॉलो करने हैं। जहाँ जरूरत ना हो उसमें घर से बिल्कुल बाहर ना निकले, कोशिश करें कम से कम बाहर निकलना है। और जबकि निकलना भी पड़ा घर से बाहर तो कोशिश करें कि जहाँ आप दो लोग खड़े हैं करीब 2 मीटर दूर खड़े रहें, नहीं तो कम से कम 1 मीटर दूर खड़े रहें।
Talking to AIR News, Dr. Naresh Gupta of LNJP Hospital, Delhi said that in most of the cases, the COVID-19 infections are self-limiting and very few patients are required to take admission in the hospitals.
पहले हम क्वारंटीन में भी सरकारी जगह पे रखते थे, फिर कहा कि सबको क्वारंटीन सरकारी जगह पे रखने की जरूरत नहीं है, जो लोग घर पे मैनेज कर सकते हैं वो मैनेज कर लें। अब दाखिले में भी 3 तरह की कैटेगरी होती थी, जो हल्के फुल्के केस होते थे जिसको माइल्ड केस कहते हैं, उनको जो 2 हफ्ते रखते थे, अब कहा कि नहीं हम उनको अब 10 दिन के बाद जो है वो छुट्टी कर सकते हैं, बशर्ते कि वो 3 दिन बिना बुखार के हैं। उसके आगे का 1 हफ्ता वो घर पे अपना एहतियात रखेंगे और अपने आप को आइसोलेट करके रखेंगे। तो उससे काफी हद तक, क्योंकि मेजॉरिटी केस जो है 60% केसेस में होते हैं, जब वो वहां जाएंगे तो फैमिली को, समाज को भी कॉन्फिडेंस आएगा।
In Karnataka, Bengaluru urban district has 175 confirmed COVID-19 positive cases and 6 people have died due to the virus. On a positive note, 84 persons have recovered and have been discharged. There are 21 containment zones in the city where Bruhat Bengaluru Mahanagara Palike BBMP is mandated to carry out quarantine and surveillance activities along with identifying persons prone to the deadly coronavirus infection. In this regard, the city corporation has launched Pranavayu program to create awareness on the need to self-examine their respiratory health for Bangaloreans. More from our correspondent.
Pranavayu program launched by the City Corporation in Bengaluru has been creating awareness through advertisements in media about the need to carry out self-examination for early detection of any ailment that could aggravate the situation if contracted with a viral infection. The Chief Health Officer in BBMP, Dr. Vijayendra, spoke to AIR about this new program.
Citizens more than 60 years and any other person who is having a comorbid conditions like diabetes, BP, COPD, bronchial asthma, wherein they can monitor their oxygen saturation with the help of simple instrument called fingertip pulse oximeter. If it comes down below the 90%, even though if you are comfortable, you have to go to nearest doctor and take consultation.
Several deaths due to COVID-19 are reported due to severe acute respiratory illness, ASARI. Pranavayu Awareness Program is an attempt to help people with low oxygen level in their blood to get themselves checked early before the ailment becomes fatal. Sudhindra, AIR News, Bengaluru.
Bihar recorded 32 new COVID-19 cases yesterday, taking the total number of positive cases to 611. Most of the new cases were reported in migrant laborers who had recently returned from other states. Around 96 migrant workers have tested positive for coronavirus. Cases of migrant workers testing positive were reported from the block quarantine center at Khagadia, Samastipur, Muzaffarpur and Begusarai. Number of cured patients in the state is 322. 55 patients were discharged. The recovery rate has gone up to 53%. Door-to-door surveys underway to detect positive cases. In Rajasthan, recovery rate of COVID-19 patients has gone up to 58.31. 2,162 patients have recovered so far, while the numbers of active patients in the state is 1,440. 151 patients were recovered yesterday, while 129 new cases are reported in the state. A report.
Chief Minister Ashok Gehlot has said that the workers stranded due to the lockdown should not leave for their home place. He said that such workers and migrants would be sent to their home place by special trains or buses. He instructed officials to coordinate with the railway to operate more special trains. The Chief Minister instructed to arrange shelter and food on the way for the workers who have left on foot. Mr. Gehlot has asked to make the pass process more convenient for a medical emergency, death cases or other urgent work. Meanwhile, the concerned subdivisional officer or police station has been authorized to issue pass to travel inter-district for urgent work. Jitendra Dwivedi, AIR News, Jaipur.
Maharashtra has reported 1,165 new patients, taking the total number of COVID-19 cases to 20,228. A health department official said the state has reported death of 48 patients yesterday, taking the total to 779. In Gujarat, the COVID-19 case count rose to 7,797 after 394 new cases were reported yesterday. The state's death toll rose to 472 after 23 people succumbed to the virus yesterday. Maximum 280 new cases and 20 deaths were reported from Ahmedabad alone. As many as 219 patients were discharged yesterday, taking the total number of recovered people to 2,091. More from our correspondent.
With more than 7,000 cases, Gujarat became the second worst affected state due to COVID-19. With more than 5,000 cases and more than 350 deaths, Ahmedabad remains the major hotspot for COVID-19 in the state. City and district administration have intensified sanitation work in the district. More and more private hotels and hospitals are being converted into COVID care centers. On one hand, the government is sending back migrant laborers who wish to return to their home states, and on the other hand, it has further strengthened the surveillance in the city as well as in rural areas. After Ahmedabad and Surat, the total lockdown has also been announced in Gandhinagar from today. The rapid surge in cases has also been reported from bordering Aravali district. Meanwhile, first flight carrying stranded Indians from Singapore will arrive Ahmedabad today afternoon under Vande Bharat mission. Aparna Khun, AIR News, Ahmedabad.
In Madhya Pradesh, all those policemen who were rendered their services for 30 days in the fight against corona will be honoured with Karamveer medal. More from our correspondent.
As per the official information, Dial 100 First Response Vehicle will visit homes and register FIRs on the complaints of the people. Necessary steps are being taken by the state government. After getting this facility, there will be no need for the citizens to visit the police station to register the FIR. The Director General of Police, Vivek Johri, informed that more than 6,000 policemen are actively working in various containment zones of the state. 4 police personnel have sacrificed their lives in the fight against corona, while 91 employees of police department are infected with corona and are undergoing treatment. Meanwhile, the number of coronavirus cases in the state rose to 3,457. Sanjeev Sharma, AIR News, Bhopal.
U.S. regulators have approved a new type of coronavirus test that administrative officials have promoted as a key to opening up the country. The Food and Drug Administration announced emergency authorization for antigen tests developed by Quidel Corporation of San Diego. The FDA said the test can rapidly detect fragments of virus proteins in samples collected from swabs swiped from inside the nasal cavity. The antigen test is the third type of test to be authorized by the FDA. Currently, the only way to diagnose active COVID-19 is to test a patient's nasal swab for the genetic material of the virus. It can take hours and require expensive specialized equipment mainly found at commercial labs, hospitals or universities.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. Government has rejected an audio message shared on social media claiming that centres giving 3 lakh rupees per COVID-19 patient to state to look after patients. It has termed the claim as false and baseless. Union Health Ministry has clarified that there is no such scheme by central government.
India's national broadcasters Doordarshan and All India Radio have assumed focus on comprehensive weather coverage from across the entire territory of the country. A report.
The maximum temperature in the national capital will be 40 degrees Celsius today. Delhi will witness partially cloudy sky with possibility of thunder lightning. Mumbai will see mainly clear skies with maximum temperatures of 35 degrees Celsius. In Kolkata, the maximum temperature will be 36 degrees Celsius. City will witness rain or thunder showers with strong gusty winds. Chennai will experience a partially cloudy sky today with the maximum temperature settling at 37 degrees Celsius. Jammu is predicted to experience a partially cloudy sky with 1 of 2 spells of rain or thunder showers. The maximum temperature is predicted to be 35 degrees Celsius. Srinagar is predicted to witness partially cloudy skies with a possibility of rain or thunderstorm or dust storm. Maximum temperature is predicted as 23 degrees Celsius. Gilgit is predicted to face generally cloudy sky with light rain. Maximum temperature will hover around 29 degrees Celsius and minimum temperature will settle at 19 degrees Celsius. Muzaffarabad will also experience a generally cloudy sky with light rain today. Maximum temperature will settle at 21 degrees Celsius. Diksha Saxena, News Desk.
And now an overview of today's newspapers covering COVID-19 stories. The Indian Express on its front page reports a week into relaxed lockdown, centre stays on course to open. With all eyes on May 12 meet, the Hindustan Times writes, reviving economy in COVID fight to top agenda of PM meet. Witnessing high case load, the Hindu cites the Health Ministry's decision to send central teams to 10 states. The paper says ICMR to test for community transmission in 75 districts. As the statesman mentions about the revised policy, only severe COVID patients need to be tested before discharge. A front page headline in the Pioneer writes, now patients can be discharged sans test 10 days after symptoms for mild and pre-symptomatic cases. And finally, India taking the first step in developing first Make in India vaccine against corona using virus strain. Hindustan Times writes, ICMR will develop indigenous vaccine.
And now, before we end the special news program on COVID-19, the headlines once again. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. Indian Council of Medical Research and Bharat Biotech to develop a fully indigenous vaccine for coronavirus. Special flights carrying stranded Indians abroad continue to arrive in different parts of the country. INS Jalashwa to reach Kochi from Malé this morning with 698 Indians on board. National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. And US approves new coronavirus antigen test with fast results. And with that, we end the special news program on COVID-19.